The future of medicine is being worked on right here in the Valley through the use of a remarkable device. It's called CyberKnife, a painless, knifeless surgical tool used to treat cancer. Right now, CyberKnife is involved in dynamic new studies with Valley residents in order to improve the future health of everyone.
Community Medical Centers is paving the way with their groundbreaking CyberKnife research. Registered nurse Bonnie Harkins coordinates CyberKnife Studies.
There's different phases to studies. Some of the studies that we have going on right here in the CyberKnife department are pilot studies that are originating here. They're only being done here at our department in Fresno. They're nowhere else in the world. Other studies are cooperative type efforts among other sites all around the country.
Community Regional Medical Center was the first in the world to offer G4 CyberKnife technology.
What is CyberKnife? That's a common question. It's a very precision medical surgical tool, and it uses pencil beams of X-rays to target, track, and treat tiny lesions anywhere throughout the body. The CyberKnife is a new technology. It is an enabling technology. It is so enabling that it's brought some investigators, some very smart minds, to think about new paradigms of approaching old problems.
Bonnie Harkins is one of those smart minds.
We have CyberKnife clinical trials open right now. We're actively accruing, and we have patients being enrolled on. We have a lung study for early lung cancer. We also have a prostate study, and we have a study for breast cancer.
20 staff members from community medical centers volunteered to be part of an exciting new study on atrial fibrillation, or abnormal heart rhythm.
Within a 2-week period, we were inundated with phone calls, people wanting to volunteer for this study. So these study volunteers that we have are undergoing X-rays. They're having some cardiac CT scans done, and then they're coming down to the CyberKnife department, and they're having some CyberKnife images done. And then we're going to overlay these two and see if we can compare them.
Registered nurse and clinical analyst Lorraine Vargas is one of the volunteers.
I felt that if we had the opportunity and we could do it for our organization as well as the community, that was a plus. That's more of like the professional reason why.
It's also personal. Atrial fibrillation affects Lorraine's family.
Whoever is going to need this type of treatment, once it's fully developed and analyzed, they are going to benefit. They're going to benefit, as what I understand, is it's not going to hurt very much compared to our current day treatment.
We're looking at the heartbeat, the motion of the heart. We know that we have the technology for the CyberKnife to move with the respiration, but we don't know about the heartbeat.
Patients are amazed by CyberKnife because it is knifeless and painless. The X-ray beams deliver large doses of radiation to destroy tumors in fewer visits than traditional treatment.
One of our treatment trials that we have ongoing right now is the application of CyberKnife radiosurgery for early prostate cancer. And our experience locally has mirrored the national experience very, very well. And what we're finding is that for the correct gentleman with early prostate cancer, we're finding that the men really like this treatment option.
While research takes many years, today's treatments are made possible by yesterday's volunteers.
I would love to see that time, perhaps in my lifetime, where if myself or my loved one is diagnosed with cancer, one, it's early, before it's symptomatic, before it causes any problems, and before any disruption occurs, the non-invasive outpatient treatments can be applied, and cure is achieved in a matter of weeks to months with minimal disruption to lifestyle and quality of life.
While this is research that takes years to analyze, these initial steps are made possible through the caring and compassion of wonderful volunteers and a dedicated medical team. If you would like to learn more about CyberKnife technology, visit our website at medwatchtoday.com.